New Jersey, chime time 11:09, driven by Autoland. Dennis and Judy Show. I'm Dennis Malloy.
I'm Judy Franco. We have a very exciting and fun hour ready for you. And that's because we've got guests in the studio. Don't we love having guests in the studio, Dan?
We do, especially when they're beautiful nurses. We're going to talk about career opportunities in New Jersey in the medical field, whether it's, and your daughter went into it, my daughter went into it. A lot of young people don't know which direction to go. A lot of young people have good hearts and want to help people, and the medical field offers a ton of opportunities to do that. So we'll get into that later and take some calls, but we want to introduce our nurses today. Last year, Jen was here. Jennifer Lier has been a nurse for 14 years. Hi, Jen.
Hi. First, I wanted to say thank you for having us here. Thank you for Dr. Landers and Ellen Gussick, our Chief Nursing Officer. Happy Nurses Week to Ellen and all the nurses.
Oh, very nice.
Aw.
And her friend...
We love celebrating Nurses Week, actually. It's more fun for us than it is for them.
I saw a nurse in the supermarket the other day. She had her scrubs on. I assume she was a nurse. She could have been some sort of tech. I don't know. Could have been a doctor. But more had the scrubs of a nurse. And I wanted to go up just like you do to a soldier and go, thank you for serving our country. And go up and say, Happy Nurses Week. But she could have just been somebody that didn't want to get dressed that day.
Okay, and who else are we introducing, Dennis, to our listening audience?
Kimberly has been a nurse for how many years?
33.
Oh, my God. You only look 33 years old. How's that happen?
Yeah, that's a little crazy.
Good genes. My mother always told me that someday I'd appreciate it.
Now, you've worked for RWJ visiting nurses for 9 years?
Yes.
You have to go to people's homes.
Actually, I did that for the approximately first 12 or 13 years of my home care career. And now I do the intake process. I am what they call a home care intake coordinator. And I'm at the front line receiving the referrals to help get those patients ready for the services to make sure that they...
So they come out
Isn't that what your family member does?
Yeah, well, sort of. The coding of the charts and stuff. Mm-hmm. So when people come out of the hospital, they still need nursing care, and that you help coordinate.
Absolutely. We coordinate the care to get them the right services that fit the needs that with wherever they're at in their healthcare needs at the time, depending on what has happened to them.
Is there anything you want the public to know about nurses and what you do?
That it's the best job in the world.
Well, all right.
The thing about nurses that I noticed, Dennis, and not just the nurses that come in and out of here, but nurses that I've met in my life, they all say that.
Yeah.
They love, there's always going to be a couple that are like, oh, get me out of here. But I've never seen a career, seriously, that is so beloved by the people who practice it. It's amazing. They love their job.
Do you have much patient contact?
Not as much as I did when I worked
on the
floor,
right.
Out in the field in the homes,
right.
But I still need that contact because
it's important.
It's very important. But you're still in the position that I'm in. We still interact with families and the hospital staff and the doctors and our staff because we are a huge company, and I still get all of that contact, but to go in and see that family looking at you saying, I don't know what to do next, and you can be that person to say, okay, we do know what to do next, and we're going to help you get there.
And I've been there a couple times, and there's a lot of questions when somebody comes out of the hospital and continues to need care. But Jen, you're on the floor still?
I go into the homes.
You go in the
So
home.
after she enters the referrals,
right.
Then I'm one of the nurses that goes into the house, and the first visit is an evaluation visit,
right.
And then when people get open for our services, they get assigned a nurse based on their geographic area, and that nurse is responsible for any care they receive
But
from
you're the
us.
first nurse they see.
Yes.
Do you get a lot of hugs?
Not usually.
No, because I know on the floor...
Everybody's afraid to hug in today's day.
Oh, really?
Because it could be misinterpreted. You're not allowed to touch people.
Too bad.
But
we're an Italian family, so my mom was in the hospital a couple of weeks ago for a hip replacement. And the nurses must have had sore shoulders after we left because we're all hugging every nurse up and down, and every aide and every tech.
It's good to be appreciated.
Oh, absolutely. I mean, and I don't know anybody who's not absolutely in love with nurses.
by the way, you just brought up a good point, Den. Something I remembered, and I think I might post the video of this later on. My daughter was, had a baby 3 months ago. We were in the labor and delivery room, and we were dancing because we were waiting for her. She's on the epidural, she's hanging. We're waiting for progress, and we put on music, and we started dancing in the room. And the nurse was breaking it down. I wonder if I could I think I'm going to post that later.
Why not? Well, you might have to ask her permission.
Yeah, but
put it up on YouTube.
Yeah.
Yeah, because, I've had great experiences with nurses of all kinds, whether they be labor and delivery or, just general, or the RNs on staff at a hospital. Unfortunately, I've had a lot of experience in and out of hospitals. But I have to tell you, I don't think I've ever met a nurse that didn't just A, look like she loved what she was doing, and B, that you didn't want to feel like you wanted to hug at the end. So I want to ask either one of you, without putting you too much on the spot, can you think of a quick experience that you can share that was an example of what makes you love it so much?
Well, just in general, for me, that once we open these people for services and we have that connection, that it's not one particular thing in general, it's just that these people know they can call you if they have any issues or problems, and just the help that you give them, that, they don't know where to turn and what to do, and it's just a day in, day out thing.
Of helping people.
Oh, yes.
Helping people and communicating with those people, the
yes.
relationships.
Yes.
Do you ever keep relationships?
Judy,
But when it's over, it's over.
Well, it depends on the situation. In my long years of nursing, I have had kept the relationships. You kind of have to look at the whole situation as to where you're at legally, ethically, morally when you do those things. I'd love to be in touch and remember. I do have quite a bit of a memory, and I do remember so many situations and scenarios. But yes, there are those that touch you that
you don't forget.
That you don't.
Because I'd be stalking you. I'm telling you, I'd be afterwards. If you healed me or one of my family members, I'd be like, "We're going for coffee, then we're going out for dinner, then we're going to Great Adventure."
Well, I have a particular story way back in my nursing career when I worked in the hospital. Our head nurse is what they were called at that time. Now they have many different names. She lived in the local community, and we worked on a post-op floor, and the patients had surgery, and she had to make herself go to the grocery store at 3 o'clock in the morning because everybody would go there, and they'd lift their shirt up and say, see how I healed? Look at my scar. And she just was like, I can't do this. So they remembered her, and it's that was the funny part.
And we
That's
do
great.
get our people that they may be discharged, but they come back, sometimes, and they ask for a particular nurse when they come back. They remember you and they ask for you.
My dad's
That's great.
definitely
That's
done
great.
that with visiting nurses visiting my mom now.
You can speak to that, Kim, because people ask for me, I'm sure.
Oh, absolutely. They're always, and it's a real honor for me as that head intake person when they say, I want Jen back. And they're very adamant. And I want Kathy, the therapist. And I want, this is what I want. And it's like, it makes it wonderful for us as an agency to say, yeah, we did a good job. They remembered not only the agency's name, they remembered the nurse, and that nurse was wonderful. And I mostly say yes, I would have Jen take care of me too.
1-800-283-101.5 is the phone number. If any young people or people maybe even switching careers are interested in getting in the medical field, we want to hear from you. What are you studying? What are you pursuing? What's the process for getting educated?